98% of all the thyroid hormone, the active thyroid hormone, what's called free thyroid hormone, or free T3, and also free T4, is dumped into the lymph system. So a blood lab to check for thyroid function may or may not be accurate. You understand? If you look at just 2% of the active thyroid hormone that's in the blood, and you try and determine how well a person's thyroid is functioning based upon that, instead of looking at the 98% that's dumped into the lymph system, it's sort of counter-logical, counterintuitive. It doesn't really make much sense. So probably not a good idea. Now, there's some really important things that we need to discuss about the thyroid gland that, although they may seem obvious to somebody like myself, you might not realize these things. What you eat does affect your health, obviously. The type of gasoline you put into a car does affect how the car runs. And if you put a bunch of dirt and a bunch of milk into the gasoline that you then put into your car, the car probably won't run too well. So what you put into the gas tank of a human does affect the way a human runs. And what you eat affects your thyroid. The reason that is because anytime somebody has trouble with their thyroid, they also have emotional difficulties. And that makes sense when you think about it, because the thyroid relates to the brain, and the heart relates to the brain. So both the heart and thyroid relate to emotions directly. And this does make sense, because very oftentimes people who have trouble with their thyroid are also having troubles with their stomach. A person who has trouble with their stomach is having trouble digesting and absorbing amino acids and minerals that their stomach is supposed to be able to digest and absorb. So the amino acids such as tyrosine, which is needed for proper thyroid function, and iodine, which is needed for proper thyroid function, and other minerals and other amino acids can't be metabolized properly if the stomach isn't working right. And if the stomach's not working right and those minerals aren't metabolized properly, then there'll be troubles further down in the digestive tract as well. So not many people realize that the digestive tract is like our second brain. There's actually a book called The Second Brain. It's pretty interesting. It talks about this. There are more nerve connections in the digestive tract than there are in the brain. Pretty astounding fact, huh? It's true though. There's actually more neuronal connections, there's more nerve synapses in the gut, in the digestive tract, than there are in the brain. So when people say I have a gut feeling about this, they really have the gut feeling. We talked about that in another video. And that gut feeling is coming from their gut, literally, because that's where they're making many of the neurotransmitters. They're digesting and absorbing and metabolizing these neurotransmitters that then lead them to have the feelings that they have in the digestive tract. So if a person eats the wrong foods, like nuts or seeds or lots of spicy foods, too much alcohol, too much caffeine, chips, popcorn, almond butter, peanut butter, cashew nut butter, or other nut butters, or chocolate or beans, or something else, anything that upsets their digestive tract, anything that will upset the digestive tract will also interfere with thyroid function, because as we remember, 20% of thyroid hormone is metabolized in the digestive tract through first being converted to T3 sulfate and also T3 acetate. Remember that? It's all starting to come together now. So if you're having trouble with your thyroid, make sure and make some drastic dietary changes because it'll definitely help you. Also, if you have an autoimmune thyroid condition, anything that you're allergic to, such as wheat, dairy, corn, soy, processed sugar possibly, maybe, or whatever else you might be allergic to, would irritate the thyroid because you're already having an immune response, meaning your body's already attacking something, probably an infective agent, and the foods that irritate that immune response will cause your thyroid to do poorly. And sometimes people will even have their bodies sort of like attack their own thyroid. It's really they're attacking a virus that's there, but unfortunately the result is that thyroid tissue does die permanently. So these are important things to consider when considering the thyroid gland. Now the digestive tract is where the majority of your immune system comes from as well. It comes from what's called the gut-associated lymphatic tissue. So interestingly enough, you can't make B12 without the gut-associated lymphatic tissue working properly. So the conversion, and B12 and folic acid are very necessary for proper iron balance in the blood. And iron is crucial to good health for all humans. Crucial, really, it's crucial. Without the right amount of iron, of course, you're anemic, and people who are anemic are exhausted all the time, they bruise easily, they have a lot of thyroid type symptoms. So do you see how everything is connected? That's what's so great about the triad of health. The triad of health really allows its healthcare provider who uses it to understand, diagnose, and treat people holistically using the whole person concept of healthcare, looking at the whole person, structurally, chemically, and emotionally, and understanding the different interrelationships between the different parts of the body. So now we're talking about the gut-associated lymphatic tissue, the GALT, which is very important. You can't metabolize B12 without it. B12 being necessary for the methylation pathways that rid a person of homocysteine levels being too high. So if you have proper methylation in the liver, your homocysteine levels will never rise too high, and then you'll be at a far, far lesser risk for heart disease. This is documented, this is science, this is a fact, this isn't my opinion, okay? So B12, folic acid, a methyl donor, and B6, and those are all very important in the methylation process, those particular nutrients, just so happens. Okie doke. And so to metabolize B12, you need to have intrinsic factor in the stomach, okay? And this happens in the parietal cells of the stomach, primarily. But also, later down in the colon, you need to have friendly bacteria, which then produce substances which continue with the proper vitamin B12 metabolism and utilization. It's a true story. So good digestion and having friendly bacteria in the gut are other things that are very important for proper thyroid health and immune system health. Because remember, we're talking about autoimmune conditions a little bit here with the autoimmune thyroid conditions, and without proper immune system health, the condition won't improve properly. And so some nutrients can come in helpful for some people. I try to use as few nutrients as possible in practice. I just want to diagnose exactly what's going on, fix the problem, fix the cause of the problem, rid the body of the nutritional deficiencies through this emotional and structural therapies that I do, and then voila, the person may need one nutrient or no nutrients if the therapy is effective enough, if the structural and emotional therapies are effective enough. If they need one nutrient, it might be something like zinc. It could be anything. Just everybody's different, right? I mean, there's not a generalization with the nutrients. The nutritional prescriptions are specific to that person and what they need and what their body's experiencing. So it doesn't really help that much just to talk about all the different nutrients. It's kind of silly. But common thyroid nutrients would be things like thyroid glandular substance, parotid extract, from the parotid gland, which helps to tag the food so that when the bolus of food goes down into the stomach, into the rest of the digestive tract, the body recognizes it, is able to deal with it, and then the thyroid is able to extract the proper amount of iodine from the food and other needed minerals and nutrients and cofactors and enzymes and whatnot. So that's important. Parotid extract, also thymus extract, because again, a lot of thyroid conditions are related to the immune system, and the thymus gland is the main immune system gland where you make T lymphocytes. Okay, the thymus gland is here, located sort of behind this sternal area, and it gets really small as you grow older. As a child, the thing weighs, a good ounce or 2 or 3, and then right away, within just a few years, that it sort of depletes itself. Nobody really knows why. There's theories about it, but we don't really know why. And then the thymus gland just is maybe a gram or 2 or 3 at the most, and it just sort of, there's T lymphocytes made throughout the body in different in different lymph tissue, even in splenic tissue to some extent. But it's not really. It's just interesting that people have their thymus gland break down so quickly so early in life, and nobody really knows exactly why that is. At any rate, so thymus tissue can be very helpful for proper thyroid health. Vitamin A in high doses can be useful. Vitamin A is also a nutrient that supports the liver. Any type of liver nutrient can be helpful. Any type of nutrient to help support the digestive tract can be helpful, right? Since the thyroid condition is also a digestive condition, we're learning. So, and so basically, if you